Here's the thing. If she had not agreed to come back and have the chat, then it didn't go well. So it did go well.
Went well. All right. Yeah, she did an amazing job. Okay, so let's start with, I guess we should start with this enterovirus. 10 states now, including Illinois, are now saying, and they've reached out to the CDC to say they have.
The thing is that this is not a new virus. So this virus has been, they've known about it since the 60s, but it's something that just doesn't come up very often. So now it's a non-polio virus, but what they've been finding is that you can have symptoms anywhere from mild to really severe. So the severe cases are the ones that have been heading the news lines, and what they're finding is that there have been 30 kids admitted a day in some of these states that are asking the CDC for help, and 15% of those go to ICU.
Yeah. Wait, let me ask you
15%.
something. Are they testing these kids? Because, Gina and I talked about that. My child was in the hospital emergency room twice, which I think she had this. But they didn't test her for this.
Typically, they're waiting until you have severe symptoms before they'll test, because then they'll be testing everyone, because we are, entering flu season, so it really could be just a different virus, the flu virus. So they really wait to see if those symptoms progress to something severe, and then they'll go ahead and test you.
Can they do anything about it? Because what I was reading is that they just have to they just treat the symptoms and let it run its course.
And that's such an important question, and that's good for all viruses. Viruses do not have a cure.
Right.
Bacteria do, but not viruses. So again, it's a virus, so it really is supportive care. So again, if you get really sick, that's why they have to be in the ICU to support them with fluids and, just kind of making sure that they don't succumb to this virus.
Right, antibiotics are not going to work with this.
They're not going to work.
It's a virus, but steroids might help if
they have breathing issues. And they have found that kids with asthma and breathing problems typically will progress much faster to some of those more severe symptoms. Because it's a respiratory virus, so it really just knocks out that respiratory tract system.
Now, while we're on the topic of kids, going back to school, immunizations are right at the top. Now, they should be up to date with their immunizations.
And they should.
But so should we, right?
Yes. So we are September, so we're in September. That is the beginning of flu season. So you actually should be able to get your flu shot now. Have you gotten your flu shot?
No, I have not.
I am signing up for 2.
Didn't we say last year, you say that you don't like to get your flu shot?
I generally don't. I generally don't. I may do it this year, though, because with this one hacking next to me.
But let me just tell you something. I skipped mine last year, and I never will again. I was never certain this thing worked, and I vowed I'm going to go twice. Is that possible? Can you get a double shot?
I think one is good. One should cover everything that you need.
Okay.
Now, which one should we get? Is it the shot? Is it the nasal spray?
Good question. So you can get either. So the nasal shot is not, or the nasal spray rather, is not good for pregnant patients. They should not get the nasal spray. They should obviously get the injection. So there are typically people who really should be making sure that they get the flu virus, which is people who are 65 and older. You really want to make sure every year you're getting the flu shot. If you're 64 and younger, you want to make sure that if you have any severe disease like respiratory diseases, cardiovascular diseases, if you have immunocompromised, like if you had history of a transplant, you should be getting the flu shot. So really every adult should be getting one every year, but there are people who really should heighten that awareness and make sure they get it. Pregnant women should always get it because they get really sick very quickly. During pregnancy, your respiratory system really decreases.
Oh, wow.
So you can increase your risk of getting sicker quicker, and then it can hurt the baby.
Yeah.
We don't want to hurt the little baby.
We don't want to hurt the little baby. All right, so now what about tetanus, diphtheria, pertussis? We have to get that. I didn't know we had a schedule as adults. Did you know that?
No, so you thought that after your first year of life you were done and no more? No. You still need booster shots. Your booster shots. And the good thing is that it's every 10 years.
Okay. Oh, yeah. But then we're backlogged like a car that hasn't had an oil change.
So we only got to get one at this point,
no,
right?
you can get one, and then in 10 years you can get your next booster shot. So your diphtheria, tetanus, and pertussis are really important to get your booster shots. Specifically pertussis. They've been seeing a rise on pertussis, which is, do you know what the name for that is?
Whooping
cough.
Yes.
Yeah,
I actually have
know that.
I just
you
got
do?
mine.
Yeah. Which is really good because when you are in enclosed environments with infants and babies, and the thing is that adults don't typically present with that whooping cough, so you may not know that you're exposing someone to, especially a little baby. Again, we're back to little babies. You don't want to expose the little people to it.
We don't.
And they can get really sick. So if you've like for me, when I left the hospital, I got my pertussis booster. And, I made sure that people who were going to be in close contact with the baby got it as well.
Okay.
Good idea. Good
Keep
stuff.
them safe. Okay. Now
I'm going to get me a bubbles.